there's obviously a very tragic situation going on right now in Puerto Rico. And just last week, we met Jason Friesen from TechMedics. So Jason, you can come on out. Thank you. Thanks, Jason. Can you give Jason a round of applause? So Jason's a paramedic by training. He's the founder of TechMedics International. Do you want to work? Which podium are you at? Do you want to? You're this one, okay? Come on. I hope you've been set up and ready to go. If you're not, let me know. Yeah. And if he's not, I hope we can give him some help. Does Jason have a slide deck we're ready to go with? Someone will say in my ear if he is.
There we go.
Well, you go. Okay. Well, let me tell you just for a second, he's been working in EMS development and disaster response in developing nations for around 15 years. Just spent 2 weeks in Houston after Hurricane Harvey. And I believe you're heading off to Puerto Rico in a couple of days, is that right?
Yes, that's right.
So, Jason, please tell us a little bit about what TechMedics is doing, and what you're intending and what you want from this audience.
Thank you very much. Much appreciated. Yes, good afternoon. So, as I mentioned, my name is Jason Friesen. I'm a paramedic by training, and I started this organization, TechMedics International. We are a nonprofit organization that develops 911 systems in countries that don't have them. Most people don't realize this, but when you leave the 25 wealthiest nations in the world, in most low and middle income countries, there's no way to reliably call for help in case of an emergency using a simple number like 911. However, if you do take the normal way to get to the hospital, which are untrained bystanders, good Samaritans using private vehicles, you'll see that the hospitals are packed. And as it turns out, everybody's carrying a phone. So this is what TechMedics does, is we go in to leverage these available resources and coordinate these both formal and informal services. And the way that we do that is with a software platform called Beacon. Beacon is a text message-based emergency dispatching software designed specifically for communities where access to emergency care and transport is unreliable. And it works very simply. So imagine we're in the Dominican Republic where we have one program, somebody sees a car accident at the bridge. They'll call the fire department, the Red Cross, the community-based organization to report this incident, and the dispatcher, whoever answers the phone, will take that information and send it out as a text message to all of the responders in the community. So they get a text message on their phone that says, there's an accident at the bridge, can you help? If the answer is yes, tell us how long it'll take you to get there. So if we send it to 45 people, we don't want 45 people going to the bridge. So our software will determine, based on parameters set by the dispatcher, who goes and who doesn't. You can go, we don't need you, you're too far, maybe you hold on a second. And when it meets its quota, it then assigns those responders. And so it takes them through 5 questions. The first one we've already seen is, can you help? The second one is, did you find the patient? The third is, do you need more resources? Is it a single patient, or is it a bus rollover with 15 patients? Or there's a whole family that needs to be rescued from the top of the roof. The fourth is, are you going to the hospital? If they say they're going to a hospital, it sends a text message to that hospital that says, here comes Jason with 2 patients, he'll be here in 15 minutes, and here's his phone number. Give him a call if you need to. The final question is, are you at the hospital? So those 5 questions are the exact same 5 questions we use on our ambulances in the United States. We've just taken them from the mobile data terminals and put them on a cell phone. So you can see, imagine you've been watching TV in Houston and in Irma and now in Puerto Rico. There's a lot of opportunity for this to be applied in austere environments here in the United States. And that's actually what I'm here to talk to you about, is that we have just gotten a grant from one of our board members' foundations for $20,000 to help us go down to Puerto Rico and begin to rebuild their shattered 911 system. And so there's one catch to this $20,000 though, and that's that we have to make it a matching grant. So today we're announcing that we're starting a $20,000 fundraising drive to get that money so that we can match it and be on our way down to Puerto Rico. If you are interested in supporting us in any way, I would really encourage you to check out our website and donate online at trekmedics.org/donate. If you'd like to get involved in another way though, we are trying to fill out our board with 2 new board positions, and we're looking in particular for tech entrepreneurs who have experience in startups and who understand about healthcare marketing. We're also looking for people who are willing to get their hands dirty, get involved, do some of the heavy lifting, as fundraising is not a very easy job, but we guarantee you that it's an opportunity for you to broaden your horizons and get involved in some work that really makes a difference. I'll be here afterwards if you'd like to talk, or you can check out our website and reach out to me at this contact information. And thank you very much for your time, and also to Matthew and Indu for the awesome opportunity and the conference. Thank you.
I think you're doing great work. Health2.0 is in for the first 2,000. You only have to raise 18 now.
Thank you so much.
Okay, that's good. Jason,
Thank you.
I didn't tell him to do that, so we'll have to work out. Fantastic, and we'll have that information out. All right, so just to send you off to drinks, here's our great friend, Tina Jarvis from Wolfscope.